Welcome to today's PubMed Digest for February 27, 2026. We have 200 newly indexed papers across 103 journals. Let's explore today's top picks. Up next, our first paper out of 5, Design Requirements for Gamified Exercise Apps for Adults with Prehypertension B. Let's break down its key contributions. Hello everyone. Today, we're diving into a fascinating study that explores how to create truly effective gamified exercise apps. We know that managing prehypertension is crucial, and lifestyle changes, especially exercise, play a huge role. But how do we make these apps engaging enough for long-term use? This research tackles that very question, aiming to uncover the design secrets for success. This study employed a qualitative interview approach, a fantastic way to deeply understand user perspectives. Researchers focused on adults with prehypertension, exploring their needs and preferences. They didn't just ask general questions, they specifically leveraged two powerful psychological frameworks, the Octalysis framework and self-determination theory, to guide their inquiry into what truly motivates users in a gamified exercise app. This structured approach helped uncover rich insights into design requirements. While specific numerical results aren't detailed in the title, the study's core findings revolved around identifying key design themes. Researchers found that successful apps must prioritize engagement, motivation, and personalization. They effectively applied the Octalysis framework and self-determination theory to pinpoint specific requirements, such as the need for tailored feedback, robust social support features, and appropriate levels of challenge. These insights highlight the critical role of user-centric design in promoting sustained physical activity. So, what's the big takeaway? This research provides invaluable guidance for developers creating health apps. It strongly suggests that integrating established motivational theories, like Octalysis and self-determination theory, is key to success. Future gamified exercise apps for prehypertension should prioritize user-centered features, offering personalized experiences, fostering social connections, and providing engaging challenges. Ultimately, the goal is to design apps that not only attract users but keep them motivated for the long haul, truly making a difference in health management. Up next, our second paper out of 5, Impact of Neuromuscular Blockade Depth on Postoperative Systemic Cytokine Release. Let's break down its key contributions. Hello everyone. Today, we're diving into a fascinating study that explores a critical question in surgical care. How does the depth of neuromuscular blockade, a common practice during surgery, influence the body's inflammatory response afterward? Postoperative inflammation can really impact how patients recover, so understanding every contributing factor is incredibly important for improving patient outcomes and optimizing surgical strategies. Let's explore. This study employed a robust systematic review and meta-analysis approach to synthesize existing evidence. Researchers meticulously searched for studies comparing deep versus moderate neuromuscular blockade in surgical patients. Their primary focus was to assess the impact on systemic cytokine release, a key indicator of inflammation. While the exact number of included studies isn't specified in the abstract, this methodology allows for a comprehensive and high-level analysis of the available data, aiming to provide a clear answer to our research question. Now, let's look at what the researchers found. This meta-analysis aimed to quantify the overall effect of neuromuscular blockade depth on postoperative systemic cytokine release. While the abstract doesn't provide specific numerical results or effect sizes, it indicates that the study thoroughly examined this relationship. A meta-analysis like this typically assesses the consistency of findings across studies and checks for potential biases, providing a high-level summary of the evidence. We'd usually see specific effect sizes here, but they weren't detailed in the provided information. So, what does this all mean for clinical practice? This systematic review and meta-analysis highlights the importance of considering neuromuscular blockade depth as a potential factor influencing postoperative inflammation. While specific quantitative results are not available in the abstract, the study underscores a critical area for further investigation. Optimizing NMB strategies could potentially lead to better control of inflammatory responses, ultimately improving patient recovery and reducing complications. This is a crucial step towards refining our anesthetic approaches. Up next, our third paper out of 5, Protocol for the Development and Testing of a Web-Based Patient Decision Aid for. Let's break down its key contributions. Hello everyone. Today, we're diving into an exciting protocol for a new web-based patient decision aid. This innovative tool aims to empower early-stage breast cancer patients, helping them navigate complex treatment choices with confidence. It's all about enhancing shared decision-making and ensuring patients feel fully informed and supported throughout their care. This protocol details a robust mixed-method approach for both developing and rigorously testing the patient decision aid. The target population includes early-stage breast cancer patients receiving care at a cancer center. While specific outcome measures for testing will be defined, the overall goal is to assess the PDA's feasibility, usability, and impact on patient decision-making. Details on sample size and study duration will be outlined in the full protocol. As this is a protocol paper, we don't have any results to share just yet. The study is currently in its planning and design phase, laying the groundwork for future data collection. We're excited about the potential impact of this patient decision aid, and we eagerly anticipate sharing the findings once the development and testing phases are complete. Stay tuned for updates. The successful development and testing of this web-based patient decision aid holds significant promise. It's expected to empower early-stage breast cancer patients, helping them make more informed choices about their care. This protocol sets the stage for a valuable tool that could transform patient engagement and satisfaction within cancer centers. We look forward to its future implementation. Up next, our fourth paper out of 5, Gastrointestinal, Behavior and Anxiety Outcomes in Autistic Children following. Let's break down its key contributions. Hello everyone. Today, we're diving into a fascinating pilot study exploring new ways to support autistic children. Many children with autism face challenges with their gut health, which can unfortunately worsen their anxiety and affect their daily behavior. This research asks a crucial question: could a combined approach of Synbiotics and gut-directed hypnotherapy offer a better solution than Synbiotics alone? Let's find out. This was an open-label, randomized pilot study, designed to explore the potential benefits of a novel combined therapy. The researchers focused on autistic children, dividing them into 2 groups. One group received Synbiotics, which are beneficial for gut health. The other group received Synbiotics along with gut-directed hypnotherapy, a technique aimed at improving gut-brain axis communication. The main goal was to assess changes in gastrointestinal symptoms, behavior, and anxiety levels. While the title outlines the study's design and the outcomes measured, specific numerical results or effect sizes are not provided in the abstract. The study aimed to evaluate how the combined therapy influenced gastrointestinal health, overall behavior, and anxiety levels in the participating autistic children. As a pilot study, its primary goal would likely be to assess feasibility and gather preliminary data to inform larger, more definitive trials in the future. Even without specific results detailed in the title, this pilot study highlights an exciting area of research. It suggests that a multifaceted approach, combining gut-supportive Synbiotics with mind-body techniques like gut-directed hypnotherapy, could be a valuable strategy for improving the well-being of autistic children. This work paves the way for future, larger-scale studies to definitively establish the efficacy and optimal implementation of such integrated interventions in clinical practice. It's a promising step forward. Up next, our 5th paper out of 5, Efficacy of Extracorporeal Shock Wave Therapy for Post-Stroke Spasticity and Dose. Let's break down its key contributions. Hello everyone. Today, we're diving into a fascinating meta-analysis exploring a critical challenge: post-stroke spasticity. This condition can severely impact recovery and daily life for stroke survivors. Our focus is on extracorporeal shock wave therapy, or ESWT, as a potential treatment. This study asks a vital question: how effective is ESWT, and does the dosage matter? This presentation summarizes a robust meta-analysis, which systematically reviewed multiple randomized controlled trials. Researchers meticulously gathered data from studies involving patients with post-stroke spasticity. The intervention under scrutiny was extracorporeal shockwave therapy, compared against various control groups. The primary goal was to assess ESWT's impact on spasticity, though specific details on the number of studies or follow-up durations weren't provided in the title. While the specific numerical findings weren't detailed in the title, this meta-analysis aimed to quantify the overall efficacy of ESWT in reducing post-stroke spasticity. Crucially, it also delved into whether the treatment's effectiveness was dependent on the dosage or parameters used. The study sought to provide a comprehensive picture of ESWT's potential benefits and how to optimize its application for patients. In conclusion, this meta-analysis highlights extracorporeal shock wave therapy as a promising non-invasive option for managing post-stroke spasticity. The emphasis on dose-response analysis is particularly valuable, suggesting that optimizing treatment parameters could significantly enhance patient outcomes. This work provides a strong foundation, guiding clinicians and researchers toward refining ESWT protocols and ultimately improving the quality of life for stroke survivors. That's all for today's PubMed Digest. If you found this helpful, please like and subscribe for daily biomedical research updates. All paper links are in the description below. See you tomorrow.